How was your week? This is such a nice party.
I know. It's a great way to end off such a tiring week at work.
Oh, there's Barb. I have to introduce you to her. Hey, Barb, over here.
Oh, hi, Samantha. Nice to see you.
Nice to see you, too. Hey, Jenny, this is Barb. I work with her. She's a nurse practitioner at the clinic.
Nice to meet you, Barb. Nurse practitioner? I've never heard of that. What do you do? Are you like a special type of nurse?
I guess you could say that. I'm a registered nurse with a master's degree as a family nurse practitioner. So when caring for my patients, not only do I use my holistic nursing knowledge, but I also can diagnose and treat acute and chronic illnesses.
Can you prescribe medications then?
I can prescribe most medications, but not narcotics and controlled drugs.
So you're kind of like a doctor?
No, I'm not, but as a nurse practitioner, I'm able to work independently in rural areas like up north, and can act in place of primary care providers for those who live in small communities with limited access to a physician. I still incorporate my nursing care by taking on a holistic and preventive approach when treating patients.
Oh wow, thanks for explaining. I didn't know that.
Oh, I think it's dinner time.
Oh, I'm so hungry. In BC, there are 3 streams or populations that nurse practitioners are eligible to work in. Family, which covers infants to older adults, adults, which cover adults and older adults, and pediatrics, which covers infants to adolescents.
Nurse practitioners are not meant to replace physicians, but by working together they are able to see more clients and each use their areas of expertise. For example, the nurse practitioner would use a more holistic, client-centered approach, and the physician would focus more on the medical aspects of care, thus leaving more time for the physician to focus on the more complex patients.
So let's explore how having nurse practitioners in the healthcare system will benefit clients. The nurse focuses on the client as the expert. They will often view the client, family, and community as a whole. With the shortage of doctors, nurse practitioners will help fill the gap. Nurses working in rural communities who have an expanded scope of practice can do more for their patients who are unable to see a doctor.
How is this a current nursing issue? Nurse practitioners are relatively new in BC. In August 2005, the Nurse Practitioner Regulation established nurse practitioners as a new category of registered nurse. This means as nurse practitioners are becoming more prevalent, especially in rural communities, it is important that the public is aware of their role in the healthcare system.
By encouraging more nurses to expand their scope and become nurse practitioners, we may be able to address the growing need for clients wanting to see a healthcare provider who can diagnose and treat their conditions.
As well, having nurse practitioners in the healthcare system is a more cost-effective way to provide primary care.